We are all going to use every tool at our disposal. I'm broadcasting live right now on all of my internet sites on QIK.com. Through a Nokia 95 high-resolution colored internet camera. And Nancy Pelosi can't censor that. Nancy Pelosi will have about as much luck shutting out the public today in the age of the internet as she will controlling the wind. And we will not stand for it. We're not going to sit still for it, and we'll use every tool at our disposal, social media, the internet, to communicate with our constituents. It's an outrage. This is a part of a pattern of abuse of power by this liberal majority who is terrified of the public, because liberals can't govern in the sunshine. They have to hide the truth from the public and pretend that they are conservatives in order to get away with what they're doing in the dead of night and in the dark, whether it be an energy tax, the biggest tax increase in the history of America, where they dropped a 300-page amendment in the middle of the night and were actually writing it in the Speaker's lobby and buying votes as they amended the bill on the floor, or whether it be the stimulus bill, which they dropped at 1 o'clock in the morning, 11 o'clock at night for a vote at 1 o'clock the next day. We have a pattern of abuse of power, of shutting out the public, a pattern of keeping the public in the dark that is not going to, that we're not going to stand for. I've got a newsletter at Franking right now, an energy newsletter that I've been told I cannot publish because it contains information from the Heritage Foundation, because it contains information that the majority disagrees with. Other members have had their newsletters shut out. Mr. Lundgren has taken the lead on this, and we as representatives of our constituents will not stand for it. This is un-American to shut out the public and prevent our constituents from knowing what's going on in the Capitol, and we're going to use every tool at our disposal to make sure that we let the sun shine in.
We're saying we have a crisis in health care, so therefore the government needs to get more involved and to take over various aspects of the health care industry. But if we look at this situation a little more clearly, we'll see that it's the government that's causing most of our problems and not allowing the free market health care system to work. Let's look at health care coverage in America. You've got about 60% now that are in employer-sponsored plans, and almost another 10% who have purchased their own insurance on the individual market. So we have about 70% of people with private insurance. You've got between 25 and 30% of Americans who are now in a government health plan. Certainly if you have Medicare and you can get a doctor to see you, it works just fine. But the problem is every dollar that's come in for Medicare since its inception has been spent. And there is absolutely no money in this system to take care of America's baby boomers. It has trillions of dollars of unfunded debt that'll fall on the heads of our children and grandchildren. But even worse is this problem. And let's keep looking at government versus the private plans. I think most people in America would believe the best situation now in health care is to have a health insurance policy so you can pick your own doctor and decide with your doctor what kind of health care that you're going to get. You have here about 70% of people who are in that situation. But every year, their insurance costs more money. Every year, these government plans pay physicians and hospitals less. They pay a physician less than their cost to see a patient. And I have doctors I know back in South Carolina in rural areas, they have to close their practice to new Medicare and Medicaid patients because once over 60% of their patients are Medicare or Medicaid, they can no longer make a living. And that's happening all over the country. But you know how these costs are picked up. That the hospitals and doctors who take Medicare and Medicaid have to charge private insurers more money every year, because every year the government pays doctors less. That's why fewer and fewer of our best and brightest students are going to medical school, and that we're headed for a real physician shortage in this country, not because of private health insurance, but because of government plans. We've got about 16% who have no coverage in our country today. Those are the ones that we say we're concerned with right now. The government requires hospitals to provide them service whether they have any insurance or money anyway. And where do these costs go? They're transferred to those who have private insurance. So every year, the inept government is transferring huge amounts of cost over to those employers and those individuals who are buying private health insurance. And now my colleagues are trying to say, this is what's failing us. We need to expand this part of the health care market, the part that's not paying doctors and hospitals to see patients, the part that's trillions of dollars in debt, and the part that's already beginning to ration health care for those who are under those plans. If you want to know how the public option is going to work, I just encourage you to drop by a Social Security office, take a number, and sit down and wait for them to get to you. Or maybe go to a veterans hospital or another government service. Do we really want the government involved with health care? Health care is the most personal and private service that we have as Americans. Do we want to turn health care over to the most impersonal, the most bureaucratic, the most wasteful, and in many cases the most corrupt aspect of our society? What we do need to do is look at how we can get these private plans in the hands of those who have no insurance. This is being misrepresented to exaggerate the problem, to create a crisis so that we can justify another government takeover over another area of our economy.
Well, the Senator is talking about having a Fannie Mae or Fannie Med type organization in every state, a government-sponsored organization that decides what insurance you can have and what you can't have. It makes no sense when all we have to do is take these barriers away from interstate competition of insurance plans. We could have dozens and dozens of insurance companies competing for the business of my children and his children. We don't need the government to take this over.
Now it is getting nasty. The president accusing Republicans of trying to score political points with health care and pointing to this comment.
Just the other day, one Republican senator said, and I'm quoting him now, if we're able to stop Obama on this, it will be his Waterloo. It will break him. Think about that.
I'm ready for the debate. Frankly, when he was in the Senate, he voted against every reform proposal that Republicans put up that would have made health insurance more affordable and more accessible. Now what he wants to do is a government takeover. And my comments get right at the heart of the matter. He's been on a rampage to take over various aspects of our economy, spend and create debt that we've never seen before, and raise taxes to just about every American. We've got to stop him. If we don't, he's going to get right on this cap and trade, energy tax. The whole purpose of the Senate is to slow things down and debate them. He wants to pass things before we even read them. He did it on the stimulus plan, which has turned into a colossal failure, Neil. And now he wants to pass something that affects a fifth of our total economy in the next 2 weeks, and no one has even seen an entire bill. He doesn't even know what's in it, and he's admitted it. So this makes no sense. The bill doesn't take effect until 2013, and he's saying we have to pass it in the next 2 weeks. The president voted with the insurance companies when I put a bill on the floor that would have allowed Americans to buy insurance anywhere in the country. The big insurance companies are against that because they would have to compete. The fact is, Republicans have introduced many more reform proposals over the last several years than the Democrats. The Democrats have killed it because they don't want private insurance to work. They want the government to run our health care system. That's what this so-called reform is all about. The president wants to take over health care just as he's taken over General Motors and Chrysler and our banking industry and our insurance industry, but he doesn't want to debate it, and I think he's played right into my hands because he started talking about his health plan. Now people want to know what's in it. If they find out what's in it, Neil, they're not going to want it to pass.